disease activity. So yeah, but in the lens study 2 weeks, there is a difference between the baseline and the 2 weeks values about the bowel wall thickness. So yeah, I want, if the patient is remain active phase, we want to perform the intestinal ultrasound 2 weeks after the induction therapy.
Thank you for answering.
So another point I'd like to make clear is that our study, the aim of the study, just to detect how early we can get the change in bowel wall. But our study does not aim to suggest the patients to repeat ultrasound early at week 2. Okay, I should like to make this point clear.
Okay, thank you. So we got one question from audience. So question is that, is there any study or report to predict response to biologics in patients with inflammatory stricture in Crohn's disease using elastography? So Professor Sagami mentioned that usefulness of shear wave elastography, right?
Yes.
So
I think in this year's DDW, there are 4 studies to deal with elastography, especially shear wave elastography. And all study reported that the baseline of the shear wave elastography is very useful to predict the effectiveness of the induction therapy. Yeah, so I think elastography is very useful to predict.
What's your experience, Professor Mao?
Actually, this is very good questions. According to my knowledge, I'm not aware of any full text paper published already regarding to use elastography to predict the treatment effects in patients with stricture. So just as mentioned by Dr. Sagami, including my study from our center and the DDW poster, I remember those studies include patients with non-stricture disease, not the stricture. Yeah, but I'm pretty sure in the future they're going to some study trying to investigate this very interesting issue.
And I want to add the information about the elastography. I think when we push the transducer to the abdomen too hard, elastography value is become so strong. So we should perform the intestinal ultrasound very softly compared with a usual intestinal ultrasound.
But I agree with Dr. Sagami. I think probably this is according to theory. If there is more inflammation, the tissue is going to be more soft, and this patient is going to have a good and better response to the biologics. So if the tissue is very stiff, there is more fibrosis, this patient is going to be not so response to the biologics. Yeah.
I ask a practical question for you. Many doctors do not perform shear wave elastography. So can inflammatory strictures and fibrotic strictures be differentiated using conventional ultrasound? Can you differentiate inflammatory stricture and between a fibrotic stricture with conventional ultrasound?
Okay. So I will give my answer and give to more comment from Dr. Sagami. So actually, there was a very simple index to differentiate using the conventional ultrasound. If there was a stricture with pre-dilated